indeed. The poor patient who had every anticipation of perhaps getting insurance, actually having a doctor, is going to have to pay more money, has been literally yanked out of his doctor's office, put into an abyss of another financial system, now called an ACO instead of an HMO. I mean, put any letters behind it as you want, it doesn't work. You know, the idea that patients need insurance is, of course, true. Nobody wants to be caught with their pants down without health insurance, fire insurance, car insurance. God forbid. No, financial disaster is unspeakable. However, in healthcare, people need a doctor. They need somebody to call. So yesterday, true story, my patient emailed me a picture of her eye. She'd had a little broken blood vessel in her eye, and it was red, and she was very concerned. So she emailed me the picture. It was great, and I told her not to worry, what to do about it. She asked, can I still take my medicines? And I said, absolutely, take your medicines. Then she emailed me back, and she said, Dr. Zwelling, do you know that I've been on hold trying to get in touch with my ophthalmologist for hours? They haven't returned my call. I was ready to go to the emergency room. And a simple email to you, and it's done. Now, how hard is that? It's not. It took me 30 seconds on a bad day. She had access. Access is not a card. Access is a person on the other end. It's not some nurse in a call center who you've never met, who's got some kind of medical legal obligation to somebody else. It's me, my patient. We have a relationship. It's relationships. Everything good in life is about relationships. Where do you go to spend Christmas dinner? With your friends. You don't go nobody wants to stand in line in the Mission, even though it's there. As I say, patients have been given numbers. They've been given assignments. And it's kind of like, remember when you were in school and you had assignment of a homeroom, and you went to your homeroom? What would it be like if you went to your homeroom class and all the seats were taken? That's what's going on now. The seats are gone. The patient's got an assignment. He calls up the doctor. The waiting time for a routine visit is 4 months. That's not a relationship. That doesn't work. Who cares about insurance if you can't see your doctor? This system isn't working. It has dismantled everything good about healthcare. You've got doctors behind a computer filling out forms. Staff behind a computer filling out forms. And a patient sitting in a chair just begging for someone to listen to them. It doesn't work. Healthcare is not about paper. It's not about forms. It's about people. And we've completely missed the boat. We have an electronic medical record system, so expensive. And now, of course, we learn it doesn't work. It doesn't work at all. Just decreases doctors' productivity. Doctors such as myself were in our offices late into the night filling out the computer. Do you know that the new system they call it meaningful use. I'm not sure who it's meaningful for or what use it might have, but the new meaningful use asks questions like a patient's sexual predisposition. It's true. Mrs. Smith fell and broke her ankle, and the orthopedist has to ask her who she's having sex with in order to get paid appropriately. Oh, that makes a lot of sense. That really strikes up a great relationship. What kind of crap is that? And now they're actually thinking about making doctors the purveyor of guns. We have to figure out who owns guns, who doesn't own guns. My job is to take care of the person sitting in that chair or lying in that bed, asking a question, needing help. I don't work for the government. They don't belong in the room. And all of that mishmash, I'll call it mishmash because I don't know how else to describe it, has actually increased the cost. I have been reading in newspapers over and over every day. There's another, even the New York Times is finally coming to the debate and saying, oops, maybe we made some mistakes. But here's what I find fascinating. I don't know if you know anything about string theory. String theory is a pretty difficult concept to grasp. I have a pretty tough time with it. But I think more people are willing to try to grasp string theory than understand the concept of basic market economics in healthcare. Why can we not talk about doctors working for patients? Post your prices, charge the patient, and walk away. You're done. Be responsive and responsible to the person in the room. Why is it a secret how much a chest x-ray should cost? A blood test. That's crazy. Totally insane. You look up online, you can find out what some chief of staff's salary is, but you don't know what the cost of your gallbladder surgery is going to be. Isn't that crazy? It's your gallbladder surgery. You're going to have a task performed. Shouldn't you know what the value is? And it's somehow, that whole subject is foreign. It isn't even on the plate. And when I talk to my friends in the Conservative Party, they tell me that the Democrats are absolutely unwilling. No. They're just lazy because their patients would love it. If you talk to a real patient and you say, would you like to know the cost of your blood test, your x-ray, your surgery? They are foaming at the mouth to get it. Would it be okay for you, Mrs. Smith, if you paid for that rather than expecting somebody else to pay and had a lower insurance premium? They would love it. People want control of their lives. But for some reason, when it comes to health care, the government thinks nobody can be responsible. They can buy a car, you can send your child to college, you can manage your loan, you can buy a house, you can buy complicated computer equipment, but you can't decide if you need your gallbladder taken out or not? It's nuts. It's totally crazy. It makes no sense and it's inconsistent. So we have to start thinking about healthcare as a legitimate commodity, a product that has value, a sign of value, and guess what? The market will help us with that. If your price is too high, nobody will come. If it's too low, you'll have a line. It's no different than McDonald's and Ruth Chris. People understand the difference between a steak and a hamburger. They know what they want. They know what's good. I think they can do the same with the doctor. Did the doctor answer my question? Did he take care of my problem?